Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is the paranasal sinuses, blood and nerve supply, lymphatic drainage, development and functions, free medical education. Arterial supply of the paranasal sinuses. Blood supply and nerve supply of the paranasal sinuses follow the embryological origin. Frontal and ethmoidal sinuses are from the frontonasal prominence of the first pharyngeal arch. Therefore, they are supplied by the branches of the artery of the frontonasal prominence, the ophthalmic artery, which comes from the internal carotid artery. Maxillary and sphenoidal sinuses are from the maxillary prominence of the first pharyngeal arch. Therefore, they are supplied by the branches of the artery of the maxillary prominence, the maxillary artery from the external carotid artery. Frontal sinuses. Frontal sinuses are supplied by anterior ethmoidal artery, supraorbital artery, supratrochlear artery from the ophthalmic artery of the internal carotid system. Ethmoidal sinuses are supplied by the anterior ethmoidal artery and posterior ethmoidal artery from the ophthalmic artery of the internal carotid system. Maxillary sinuses. Maxillary sinuses are supplied by the sphenopalatine artery, infraorbital artery, alveolar artery from the maxillary artery of the external carotid system. Sphenoidal sinuses. Sphenoidal sinuses are supplied by the sphenopalatine artery and pharyngeal artery from the maxillary artery of the external carotid system. Branches of the external and internal carotid arteries anastomose in the nasal cavity and paranasal sinuses, one of the site where two systems anastomosed. Venous drainage, nerve supply, and lymphatic drainage of the paranasal sinuses. This column is about the venous drainage, this is about the nerve supply, and this is about the lymphatic drainage of the paranasal sinuses. They are frontal sinus, ethmoidal sinus, maxillary sinus, and sphenoidal sinus. Venous drainage of the paranasal sinus. Frontal sinus is drained by anterior ethmoidal vein into superior ophthalmic vein and finally into the cavernous sinus. Ethmoidal sinuses are drained by anterior and posterior ethmoidal veins into the superior ophthalmic veins and finally into the cavernous sinus. Maxillary sinuses are drained by alveolar veins, which drains into the sphenopalatine vein and into the pterygoid plexus of veins and finally into the cavernous sinus. Sphenoidal sinuses are drained by posterior ethmoidal vein into the sphenopalatine vein to pterygoid plexus of vein and finally to the cavernous sinus. Nerve supply. Frontal sinus is supplied by supraorbital nerve, that is the ophthalmic nerve, that is first division of trigeminal nerve. Ethmoidal sinus is supplied by anterior and posterior ethmoidal nerves from the nasociliary nerves, that is from the ophthalmic nerve from the first division of the trigeminal nerve. Maxillary sinus is supplied by infraorbital nerve, anterior, middle and posterior branches of the superior alveolar nerve from maxillary division, that is the second division of the trigeminal nerve. Sphenoidal sinus is supplied by posterior ethmoidal nerve from nasociliary nerve from ophthalmic, that is the first division of the trigeminal nerve. Lymphatic drainage. The lymphatic of the paranasal sinuses form a capillary network in the mucosal lining and drain into, from frontal sinus, drain into submandibular nodes, ethmoidal sinus to retropharyngeal nodes and submandibular nodes, maxillary sinus into submandibular nodes, sphenoidal sinus into retropharyngeal nodes. Lymphatic drainage of the paranasal sinuses. Lymphatic of the paranasal sinuses form the capillary network in the lining mucosa, which together with the lymphatics of the nasal cavities drain into the lymph nodes at the following Robbins levels. First is Robbins level 1B. It is actually submandibular nodes. This is the one, submandibular nodes. It also receives lymphatic from the retropharyngeal nodes. From level 1B, lymph will drain to Robbins level 2. This is Robbins level 2. It is superior deep cervical nodes, also called jugulodigastric nodes. From Robbins level 2 drains to Robbins level 4. From here it drains to Robbins level 4. This is also called inferior deep cervical nodes or called jugulo-omohyoid nodes. From Robbins level 4 through the jugular trunk to right lymphatic duct on the right side and thoracic duct on the left side drain into the venous system. Development of the paranasal sinuses. Mucous membrane of the nasal cavity is lined by respiratory mucosa, that is pseudo-stratified ciliated columnar epithelium with mucus-secreting goblet cells. Paranasal sinuses are developed as diverticula of the nasal mucosa of superior, lateral, and anterior mucosal walls. They extend into the surrounding bones and dilate into frontal, ethmoidal, maxillary, and sphenoidal sinuses. They reach the maximum size during puberty. This diagram is the coronal section of the paranasal sinuses on the left side of the nose. These are the color boxes showing the size of the age group. For example, this yellow color means at birth, blue color means 1 year, and etc. like that. So this is frontal sinus, this is maxillary sinus. In frontal sinus, there is no yellow color, means it is not present at birth. But it has blue color, so that means it is formed at 1 year age group. Green color up to here shows that at 7 years it is about this size. In the case of maxillary sinus, you can find yellow color. That means that it is present at birth, maxillary sinus. Say green color means maxillary sinus is about this size at the age of 7 years. This is name of the sinuses, status of each sinus, first radiologic evidence. Maxillary sinus present at birth, form at about 4th month of intrauterine life. First radiologic evidence is at about 4 to 6 months after birth. Ethmoidal sinus present at birth. First radiologic evidence is at about 1 year after birth. Frontal sinus not present at birth. First radiologic evidence is at about 6 years after birth. And sphenoidal sinus not present at birth. First radiologic evidence is at about 4 years after birth. Sequence of development is from inferior to superior. That means maxillary first, ethmoidal second, frontal third, and finally sphenoid sinus is formed. Functions of the paranasal sinuses. Mucous membrane of the nasal cavity and paranasal sinuses are lined by respiratory epithelium, that is pseudostratified columnar ciliated epithelium with mucus secreting goblet cells. Deep to the mucosal layer lies neurovascular plexuses. Paranasal sinuses increase the surface area of the uppermost part of the respiratory tract. However, it is not clear about the functions of the paranasal sinuses. Probably they are to provide resonance to the voice, to adjust the temperature and humidity of the inspired air closer to the body's need, to act as a crumple zone to decrease the force of impact and protect vital structures in the event of facial trauma, as defense, trapping the dust and microorganisms by mucus and sweeping out to the nasal cavity by the cilia, to provide local immunological defense, to lighten the skull, and for the growth of skeleton of the face after birth. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.